Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Kokar, Professor of Forensic Medicine, and starting with the next topic, traumatology. And this is also called as mechanical injuries because certain mechanics are involved in the causation of the injuries, hence it is called mechanical injuries. This is the first lecture, and the contents of today's talk will be that I'll be discussing what are various definitions and what are various other legal terms and what are the terms in Qisas and Diyat ordinance, which is the law which is prevalent in our country. Then, what is the classification of various trauma terms, classification of traumatology, and medical legal classification, then the HERTS, which is the law prevalent in our country, that is the Qisas and Diyat law. And then we'll discuss the mechanism of wound production, that how the wound is produced. Then what are the basic components which are necessary for the causation of the trauma? So what is trauma? This is basically the physical or the structural damage to the body by the application of some force or energy. And we know the logi is the study, so it means in the simple words that this is the study of injury or the study of physical and structural damage to the body which is occurring. Then, by definition, traumatology is the science which deals with the study of physical and structural damage to the human body as a result of application of physical force. Then mechanical injuries it is called as because there are certain mechanics which are responsible in the causation of the injury. And various terms add that injury, wound and hurt. These are various terms and we will try to understand what does they indicate, what does they mean. The injury, it's a discontinuity or break in the continuity of the body tissues externally as well as internally is called as injury. Then the wound is also is a medical term and it is not defined by the law. And wound is a breach in the integrity of the tissue. Hence, both the words to the medical man means the injury and the wound having the same meaning and having the same pathological entity. That means breach in the continuity of covering of the body externally as well as internally, that is injury or wound. But in PPC, Pakistan Penal Code, which is the law, it describes injury as any harm caused illegally to any person in body, mind, repute, and property. That means the law describes injury not only to the physical structural damage to the body of a person, but his reputation, his property, and his mental suffering. So that is injury under PPC. Then, when the new law, Qisas and Diyat, came, the injury has been replaced by hurt. So we use the term hurt under Qisas and Diyat law since 1991 in Pakistan. And they introduced injury as a hurt. And it gives a more clear and elaborate understanding of the physical damage due to criminal hurt for the first time. This is the first time the better understanding, better explanation. When we'll go into the detail, we'll understand how it elaborates because the hurt gives according to the layers, according to the amount of damage, then they classify according to that particular matter. So it also elaborates the compensation for the physical suffering. So not only the physical amount of physical damage, but also how much the physical or monetary compensation is to be made for that particular physical suffering. So this law is imposed not only to give punishment to the culprits, but also compensation to the sufferers. So injuries have to be recognized and they have to be declared in legal terms according to the provision of the law. So that means that doctor, when describes any injury, he should describe it according to the dictates of that particular law, because law will understand only the legal term, and doctor should always try to dictate according to the legal term, so that the not only the amount of damage the law can understand, but also the compensation according to that damage will be compensated. So the legal definition, they are comprehensive and cannot be changed. So we being the doctor should abide by and should always follow those legal definitions, and they should not be reproduced with any alteration. Sometimes an injury may be insignificant in the eyes of the law, but it may prove fatal and cause death in medical views, like bruise. Bruise apparently seems a simple injury, but if it is extensive, if it complicates, if it becomes infected, and there is much accumulation of blood underneath, the person may it may be fatal and person may die of these injuries. So apparently, a bruise is a simple injury in the eyes of the law, but it may become uh, lethal consequences. Then in Pakistan Penal Code, the injury is defined under the section of 319 PPC. So need not to know doctor about the section, but he should know that this is the 319 PPC. And section 320 PPC, that describes the grievous hurts. So this is another term, grievous hurts. This was previously defined. Sometimes it is not prevalent because the law of PPC is still existing. But uh, when we feel it that it should be according to PPC, we can fix the section. Basically, the law courts and the police can fix those sections. So, section 320 is for the grievous hurts. But now these two sections, section 319 and section 320 of the PPC, they are replaced by Qisas and Diyat law, as I already told. And now they comes under the section 320 of Qisas and Diyat Act, in which there is not only punishment but also the compensation. Previously, the legal terms of grievous hurt, we will just understand that term. Under the section 320 PPC, the grievous hurt were emasculation, that is removal of the testes, loss of eye, loss of ear, permanent impairment of any joint, permanent disfigurement, fracture of a tooth, or any hurt which endangers life or causes impairment of normal pursuits of the person for 21 days. So you can imagine the suffering of fracture of a tooth, suffering of fracture of a femur, or any hurt which interferes the pursuit, normal pursuit for the 21 days, they all are grouped in one. They are grievous hurt, and the punishment will be only for the grievous hurt. So that's how the Qisas and this law has compensated this law according to the amount of damage, and then punishment and the compensation will be according to the amount of damage the culprit has caused to the sufferer. Now the hurt in Qisas and Diyat law. According to Qisas and Diyat law, the hurt means causing of any pain, harm, disease, infirmity, injury, or impairing, disabling, dismembering any organ of the body or part of it thereof without causing death. So, this is important, injury without causing death. So, all you can imagine all types of suffering to the physical body has been covered. Pain, harm, injury, disease, disfigurement, disablement, fracturing. So, all has been covered in this hurt. And now we try to understand what are various classification. We can classify injury according to various parameters like anatomical classification. This is basically the structural appearance and we classify as closed wound, open wound and burns. So these are the classification which structurally appear to us. The closed wound, they can be abrasion, they can be bruises, contusion, or the open wounds can be the lacerated wound, the incised wound, and penetrating wounds. Similarly, the stab wound, puncture wound, firearm injury, they are all open wounds. Blast injuries. Then the burns, they can be either by the dry flame burn, the wet burn, the sunburns, or corrosive burns, electrical burns. So the all sort of burns, the lightning burns, the X-ray burns, they are the anatomical disfigurement. Then the medical classification, they are mechanical injury, thermal injuries, chemical injuries. Mechanical when certain physical mechanics are involved. Thermal when the temperature variation or chemical various chemical acid or alkalis or any other chemical. Then electrical various type of electricity, the domestic, the industrial or the lightning, they are under electrical injuries. Then on the manner of infliction, that means it is suicidal, homicidal, accidental, or any other manner. So these are basically the manner of infliction of the injuries or self-defense. So injuries legally they are under the Qisas and Diyat law in hurt and on the manner of infliction they can be homicidal, suicidal or accident and on the base of the causative agent it can be uh, classified according to simple one causative agent or multiple causative agent. So the manner of infliction, homicidal, suicidal, accident, and self-inflicted legally is according to the hurt of Qisas and Diyat law. So on the basis of the causative agent, sharp edge injuries, blunt injuries, firearm injuries. So these are upon the base of the causative agents. Then the fire injuries and electrical injuries, chemical injuries, and radiation injuries. So these are all according to the causative agents. Then the medical legal classification, the wounds can be mechanical and others. The mechanical wound can be by the single causative factor, which can be the blunt. Blunt weapon will cause abrasion, bruises, or the laceration, or the weapon can be sharp, and the sharp weapon will causing the incised wound and the stab wound. And the mechanical, other mechanical, multiple causative factors, these are blast injuries and the firearm injuries. And firearm injury, there are two types of weapons, smoothbore and rifled. And the rifled weapon can be low velocity and high velocity, and high velocity can be of weapons of long barrel and short barrel. So other wounds can be with the temperature variation, that is the hot or cold. The hot can be dry hot or wet hot. Similarly, the electrical can be artificial or natural, and the artificial can be high voltage, low voltage, and low voltage. The injury will be varying from loose contact or firm contact. There will be variation in appearance. Then radiation can be natural and artificial. Natural can be UV or ionizing, and similarly, artificial can also be ionizing and non-ionizing. The chemicals like corrosives, acids, and alkalis. So these are other uh, types of injuries by other wounds. Now, what is injury in PPC? Any harm caused illegally to body, mind, repute, and property. So, PPC says body, mind, repute, and property, but the hurt classifies elaborately in Qisas and the authority about the physical suffering of the person. So, what is hurt in Qisas and Diyat? Again, whosoever causes pain, harm, disease, infirmity, injury, or impairing, disabling, dismembering any organ or part of the body thereof without causing death, this is hurt. So, again, I am repeating these two: PPC, body, mind, repute, and property, whereas hurt here completely on the physical suffering of the person. Now, we talk about the mechanism of wound production. For it, we should understand what are the basic components in the causation of the trauma. There are basically three components which are responsible for causation of trauma. Weapon, that the object. The tissue, the subject where it is going to strike. And the contact, that means the contact area. With the force and movement, the contact area will be causing that injury. So, force and movement, weapon, and tissue, they are three components, they will cause trauma. So these are basically three important factors which are responsible for the wound production, and also they cause variation in the appearance of the wound. So these factors are main responsible for causing the change in appearance of the wound: object, subject, and the contact with force. Weapon is the object, tissue, the subject, force and movement, and the area of contact. So if any one of these factors is missing, there is no wound production. For example, weapon is in hand of me, subject is in front. Until unless there is contact, the wound cannot appear. So if any one of these factors is missing, wound will not be produced. So we'll discuss first factor, the weapon. When we study a weapon or a subject or an object, which is responsible for causation of the wound, there are certain factors within that object, like intrinsic quality of the weapon itself, amount or quantity of force dissipated, and velocity or movement of the weapon with which it was used. Now, when we talk about the intrinsic quality of the weapon or the object itself, which is responsible for causation of the wound, every object, every weapon has got certain intrinsic characteristics: smooth surface, rough surface, sharp edges, rounded. So, all are these intrinsic characteristics. These characteristics are going to transfer to the tissue in the form of trauma. So that is the intrinsic factors which are responsible in the change in the appearance, like weight, mass or the size, small size, large size, small weight, heavy weight. So variation in weight will cause the difference in amount of trauma. Similarly, the weight and size. Surface may be smooth, surface may be rough. The rough surface may be imparting its own characteristics. Then the shape, the edges, round shape, the conical shape, so they will change the appearance of the wound. Margins, angle, sharp or rough. So these are the intrinsic qualities within the object which make a weapon either a blunt weapon, a sharp edge weapon, a firearm. So these are the characteristics within the object or weapon itself which change the weapon as a blunt, as a sharp edge, as a firearm. So the wound production, the wound which is produced as a result, will show enormous variation in appearance depending upon these characteristics, depending upon the size, depending upon the shape, amount of weight, energy dissipated, movement. So all these intrinsic factors, if we particularly talk about the object has got intrinsic characteristic within, it will change the appearance of the wound. But an exception to this, that is the blast injury. That means there is no contact between the object and the subject, but even then the trauma occurs. And this is basically because of the shock waves which are traveling in the air and they are transmitted through the body and they cause enormous damage. So the blast, there is no direct contact between the subject and the object, and even then the trauma occurs. And this trauma is because of the pressure waves or the shock waves which are traveling circumferentially from the area of the blast around, and they are traveling with high speed within the body and cause enormous damage. Now, we talk about, depending upon the intrinsic qualities of the weapon, the blunt weapon. The blunt weapon may be a brick, a stone, a wooden stick, a metallic stick, or metallic rod. They are all blunt. These are few pictures showing various blunt objects, blunt which becomes the weapon when they are used with the evil intent. And in case of blunt weapon, the area of impact is wider. So the amount of dissipated energy, amount of damage towards unit point will be less because broader surface is being in touch, and per unit area energy being transmitted is less than if a weapon which is being used on a single point or single edge, like screwdriver. You can see the tip will be dissipating energy on one point, but there is a rod is offering a broader surface, and per unit transfer of energy will be much less. So there will be tearing and crushing. When the blunt weapon is being used, the broader surface is dissipating the energy. The amount of energy dissipated per unit will be less, but there will be tearing and crushing of the tissues. And the wound produced will be either a lacerated wound, or bruise, or an abrasion. Now, when we talk about the sharp edge weapons, in sharp edge weapon, basically either the tip of the sharp edge weapon or the edge of the weapon is used. So the whole force is either concentrated at the tip when tip is being used, or it is upon the edge when the edge is being used. When the tip is being used, that means you are thrusting the weapon into the body and there will be deep penetration and the injury will be more deep than the width. So that will be a stab wound or penetrating wound within the body. And when there is the edge being used of the short weapon, that will cause clean cut cleavage of the tissues, and the wound will be uh, more in length than in depth because the edge is being dragged on the surface of the body. So they will be producing incised wounds. Whereas when the tip is used, they are producing the stab wounds. This is the firearms. You can see the flame, the smoke. So in case of firearm, the bullet is moving at a very high velocity and the area of impact of the bullet on the body is very small. So enormous amount of energy is concentrated on a single point of entry if the bullet is entering into the body. And there will be extreme concentration of force at one point, and a special type of wound is produced that is having an entry wound entering into the body, and exit wound if the bullet exit from the body, and there is an intervening track from the entry wound to the exit wound, the intervening area through which the bullet has traversed within the body, traveled within the body, and caused the damage, lacerating various viscera, that is the track of the bullet. So the firearm, this is called as a special trauma because it contains the whole traumatology. All types of injury will be visible. There will be burns, blackening, tattooing, abrasions, lacerations, fractures, and the track within the body causing an enormous laceration of the viscera. So this is a special traumatology, and we see here all types of injuries. Thank you very much. This is all about the introductory lecture of the traumatology. We'll continue in the next. Take care.